Welcome everyone. This is Colleen McCarthy O'Toole from CureSMA's Family Support Department. Thank you so much for joining us for today's presentation of Care for the Caregiver. We would also like to thank our national presenting sponsors, Biogen, Genentech, as well as our platinum sponsor, Accredo, and supporting sponsor, Scholar Rock, for their generous support of the 2021 Summit of Strength webinar series. We appreciate all of the questions that we've received in advance of this webinar, and we'll try to answer many of these during today's presentation. You are also able to submit questions throughout the webinar using the questions box, which you will find located in your GoToWebinar toolbar. Be sure to stay on until the end to participate in the Q&A session as well. Please note that all lines will remain muted during the webinar. If you have any additional questions after today's presentation, please contact the CureSMA Family Support Team at familysupport@curesma.org. We will be starting today's summit off with an opening presentation from Rose Domenico-Horn, representing Biogen, who will be sharing their presentation, The Transition from Pediatric to Adult Care in SMA. Rose?
Thank you so much for that introduction. As noted, my name is Rose Domenico-Horn, and on behalf of Biogen, I will be sharing this educational presentation on the transition from pediatric to adult care in SMA. Next slide, please. Spinal muscular atrophy is a disease which affects individuals across the lifespan. With our advancing knowledge of SMA disease pathophysiology and the underlying genetic basis for disease, we can now think of the range of SMA phenotypes as representing a continuum of a single genetically defined disease, which can affect very weak infants to ambulatory children and adults. With the evolution of the standard of care in SMA and the development of 3 FDA-approved disease-modifying therapies, the trajectories for survival and motor function are changing, and therefore so is the phenotypic spectrum of disease. Next slide, please. In comparison to natural history, patients who receive one of the FDA-approved therapies may experience the achievement of more advanced motor milestones and fewer complications of their disease. For example, an infant with type 1 SMA may respond to treatment, thereby achieving improved survival and better motor function while still remaining classified under the current paradigm as a patient with type 1 SMA. But that child may even improve to the point that they experience a change in what would be the classic phenotypic classification of their SMA type to effectively appear indistinguishable from a patient with type 2 SMA. This impact on the evolution of SMA phenotypes with treatment and therapy may occur for any subtype or stage of the disease, including those patients who are identified and treated pre-symptomatically, essentially changing how we think about SMA and how it is classified. As the phenotypes of patients with SMA evolve and patients live longer and healthier lives, it is important to recognize and address the care needs that will emerge as they move beyond childhood into adolescence and adulthood. Next slide, please. The healthcare transition is the process of moving from a child model of healthcare to an adult model of healthcare, with or without a transfer to a new clinician. This represents an evolution from a focus on pediatric care to a shared responsibility for healthcare by both pediatric and adult clinicians. This is especially important as young adults are increasingly being appreciated as a vulnerable population with high rates of behavioral health risks, low rates of healthcare utilization, and susceptibility to emerging or worsening of chronic health conditions. They also traditionally regard healthcare as a relatively low priority when it comes to their transition to adulthood. Traditionally, it has been reported that young adults do not receive adequate preparations when it comes to transitioning to care administration by adult clinicians or within adult healthcare systems. The adverse effects associated with the lack of a structured healthcare transition include medical complications, poor medication adherence, discontinuation of care, higher rates of dissatisfaction, higher rates of emergency department and hospital use, and higher costs of care. Next slide, please. The healthcare transition is part of a larger theoretical framework, which includes, but is not limited to, these principles: a youth or young adult-centered focus, self-determination and self-management, family and/or caregiver engagement and support, an acknowledgement of individual differences, complexities, and vulnerabilities, the need for early and ongoing preparations and integration into an adult model of care, effective communication, care coordination, and shared accountability, the recognition of cultural and socioeconomic influences on health, and the elimination of healthcare disparities. Next slide, please. While clinicians are becoming increasingly more aware of the importance of supporting a healthy transition of care for their young adult patients, they still report significant barriers, such as a lack of communication and coordination between pediatric and adult care providers, and their often very different practice styles. There may also be a lack of training around childhood onset illnesses among adult clinicians, and therefore a lack of adult specialists available to treat these patients. Parents and caregivers may also not appreciate their role in giving young people ways to increase their independence in seeking and managing their health care. A prominent barrier mentioned by youth with special healthcare needs and their caregivers is a difficulty in leaving the pediatric clinicians with whom they have had long-standing relationships. They may describe this transition as challenging or scary. They may also feel inadequately prepared for or educated about the transition process. Youths with medical complexities and special healthcare needs may also have multiple healthcare providers, including nursing and ancillary staff, and may be very accustomed to the routines and services available in their children's hospitals and pediatric clinics. They may require frequent admissions or medical procedures, requiring more in-depth planning discussions with both their children's hospital teams and new adult hospital staff around their transition to adult care. Next slide, please. Documented benefits to a structured transition of care approach exist. Such benefits can be categorized in terms of quality of care outcomes, such as improved adherence to care, improved perceived health status, improved quality of life, and improved self-care skills, and service use outcomes, such as improved adult clinic attendance and a shorter period of time elapsing between a patient's last pediatric appointment and initial adult visit. Decreased hospitalization rates may also result. Due to these benefits and the recognition of the importance of this approach, pediatric and adult practices and systems and public health programs in the United States are increasingly implementing structured processes for a transition to adult care. In pediatric and adult hospitals, complex care centers and transition clinics are being established to coordinate inpatient and outpatient care for youths and young adults, including those with complex medical conditions, recognizing the need for individualized planning and a collaboration between their pediatric and adult clinicians. Next slide, please. One of the ways in which a transition of care is being structured is through the development and utilization of specialized multidisciplinary clinics. Multidisciplinary care is the standard of care for adult and pediatric neuromuscular disorders and has been associated with improved quality of life, resource utilization, and health outcomes. It is delivered by way of the multidisciplinary clinic, in which care can be coordinated across multiple specialties at a single visit. This can help to streamline care and reduce travel burdens for patients, while also facilitating an integrative approach to care, including clinical research and patient advocacy. Multidisciplinary neuromuscular clinics are generally organized around specific neuromuscular patient populations and specialists. They are run by a neuromuscular specialist, generally a neuromuscular trained neurologist or physiatrist, and a team of other clinical specialists, such as pulmonologists, gastroenterologists, orthopedic specialists, social workers, physical, occupational, speech, and respiratory therapists, research and administrative staff, and patient advocacy group representatives. The teams involved in the care delivered at these multidisciplinary outpatient clinics can also help to establish communication and an exchange of clinical information with the clinicians who will care for patients during hospitalizations or inpatient procedures. In the context of a transition of care framework, multidisciplinary care clinics can be useful in establishing a transition of care team for each patient, thereby coordinating cohesive, continuous care across ages as a child approaches adolescence and transitions to adulthood. As mobile health technology advances, it may also be possible to extend multidisciplinary care beyond clinic walls, such as with a combination of telehealth visits, mobile health, and remote monitoring systems, which may improve the timeliness of medical evaluations and interventions, reduce costs, and improve the overall value of care. Next slide, please. Thank you so much for your time today. We hope that this was an educational presentation on the transition from pediatric to adult care in SMA. We at Biogen look forward to speaking with the SMA community again soon.
Great. Thank you so much, Rose, for your presentation and sharing with the community today. We really appreciate you being here. And now we'd like to give a warm welcome to today's presenter, Vanessa Batista from the Children's Hospital of Philadelphia. Vanessa has so generously joined us and presented at 2 previous Summit of Strength webinars on pain management, and you can find those on Cure SMA's YouTube channel. So we are excited to welcome Vanessa back today. She'll be sharing on Care for the Caregiver. So hello, Vanessa. Thank you so much.
Hi, everyone. Thanks so much for joining in today. It's a pleasure to be with all of you again, and I am in clinic currently, but it's pretty quiet, so hopefully we won't get any interruptions, but just putting that warning out there in case the door opens. But I hope everyone is doing well, and we are going to talk a little bit about caring for the caregiver today and covering some of the stressors that caregivers experience as well. So next slide, please, Kat. So some of the different components is we'll talk about an overview of caregiving, the impact of it, and then emotional support or needs of caregivers as well. And I wish that of course, everybody wishes we had never had the pandemic and we weren't in this situation where we had to do everything by online. But on the flip side, it's given us lots of opportunities to be together in this forum. But I wish that it could be more of an open conversation, because I think for caregiving, it's something that is really nice for people to be able to share openly their experiences and to talk a little bit about them together. And so feel free to put comments or questions in the chat. And then of course there will be question and answer period at the end, and happy to have some discussion as best as we can at that time. But we'll look forward to everybody's participation, and we will have a couple of activities built in for you to do on your own as well. So let's move ahead here. Next slide, please. The next slide. Okay, so who are caregivers? And I think when we think about a disease such as SMA, right away, the first thing that comes to mind are parents when we think about caregivers, but we know that that's not always the case, right? Caregivers can be a hired person that is hired to be a caregiver. It can be certainly a parent, it can be a grandparent, it can be a sibling, it can be a spouse, it can be taking care of yourself, a teacher, someone in the community. So we know that caregivers are not one size fits all. People have many different caregivers throughout their lifespan, and they can come in all different ways, shapes, and forms, including people, again, who are hired help versus someone who is a family member who is just doing this around the clock. And so I think it's important to really think of caregivers as all of us in a way, whether that's formally, we don't think of ourselves as providers, as officially caregivers. We're not doing the care at home, but, are we included in that is the team included in who are the caregivers? And I think our focus today is really on the caregivers at home and all of the different people doing that, but it's really the way you identify it. Who is the caregiver in your family? Is it you? Is it someone that you care for, or someone that you love? So that's just a little bit of a broad context of who the caregivers are. Next slide, please. And I wish we had a way to show of hands of how many people today in the attendees are caregivers, although I'm assuming that probably many of you are. And I found this quote by former First Lady Rosalind Carter that I really liked. And there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. And so I thought this was really poignant because it really does cover the fact that caregivers are all-encompassing, right? At some point in our lives, we will either be one, need one, or have been one, right? So next slide, please. So we are going to do a little exercise now, and I'll give you just a couple of minutes to do this on your own. There is no perfect roadmap or path to living a healthy life as a parent, caregiver, or individual living with SMA, right? There's no specific set way to do this. I think people ask all the time or talk about all the time, what's the best way to do this? What's the healthiest way? How do we make this balance? How do we make sure that we're meeting all of our needs or all of our child's needs or all of our own needs? But there is no perfect way. And I think the most important thing to think about is really what works for you or what works for your family best. It's easy, I think, when we start to talk with caregivers, it's easy for people to be self-critical, to right away say, well, I'm not doing this way, or I should be better at that. We hear that all the time, or I wish I had more energy to do it this way. And I think no one is perfect, and everybody does the best that they can given the circumstances they're in. And so there is no perfect way to do this, but I think it's also helpful to realistically think about what are the boundaries of caregiving, and for yourself and for others. And I know for myself, I often have to think about, not even necessarily in the role of caregiving, but just as a person, in not committing to more than I can actually do. And if I do commit to doing something, to want to make sure that I give it my all and do a really good job, right? But sometimes you need to realistically look at the pieces of the pie, as we like to say, and say, what can I realistically do and how well can I do this? And I know for many caregivers, sometimes it is a position you choose to be in. As we mentioned, like caregivers who are paid, for example, yes, it may be a career choice or a professional position where you've chosen to actively sign up to be a caregiver. For many people in family situations, that's not the case. You were not necessarily anticipating being a caregiver, but you have no other choice. And usually people would have it no other way and really enjoy doing it, but it's someone in your family is born with a certain condition or develops a certain condition, and there you have it, and you have no formal training and perhaps not a lot of time to prepare, and you are the caregiver. And so how do you do that and set some boundaries or parameters around what you really can do and perhaps what you really don't have a choice about, right? Maybe you feel like, I can't do this anymore, I don't have any more energy for this, but you still have to get up the next day and do it, right? And so I think this exercise helps a little bit to just really think about what is it that you're able to do, and where can you give your energy, and where do you want to give your energy? Because there is 100% of you, and I like to follow that with period, right? There is no way, I think we all sort of function on giving more than 100%. Sometimes we feel like we're giving 1000%, but there really is only 100% of you. So take a moment to, if you have a piece of paper nearby, great. If not, and you, everybody obviously is in front of a computer or some device right now, you can jot this down on a screen, but just take a minute or so to really think about, if you're able to draw a circle like a pie. Probably gonna make you hungry, but to really just think about that circle or that pie. And if you can't draw a picture and just wanna make a list, that's fine too, but divide that pie, that's 100%, into the number of roles you have. So for everyone doing this, the roles may look different. It may be parent, it may be self, individual, it may be spouse, it may be daughter, son, sister, brother, niece, nephew, aunt, uncle, whatever it may be, grandmother or grandfather, a professional caregiver, but really just take a minute to divide that pie into all the different roles you have, and to think about, after you do that, which roles deserve or require the most time and which have to go. Meaning, maybe you don't want any of them to go, but maybe you're doing a ton of volunteer work or doing something on the side that you enjoy but really don't have the energy for right now. So I'm certainly not suggesting that people get rid of the activities that they enjoy, but I think those need to be a piece of the pie as well. And sometimes it's helpful to just really look at this and see, okay, what do I have time for or space for? What do I want to make more time or space for? Maybe doing that volunteer work. I'm not suggesting everybody do that, but whatever it is for you, doing volunteer work, going out and when you're able to safely do that and having a beer with a friend, going to see a movie, going in window shopping, whatever it may be for you. Maybe you're not making enough time for that in your pie or don't have enough time for that in your pie. So I'll just give you a couple of minutes here quietly to sit and do this. And then hopefully when we have the chat, if people want to share, that would be great. But just take a moment now to draw your pie and think about your different roles. Take about another minute or so. So hopefully everybody has jotted down or drawn your pie. And if you have done that, think about, move on to now thinking about where are you spending most of your time or energy, and perhaps where would you like to spend more time or energy if you could balance out the pieces of your pie. So just take another minute to think about that part. Okay, so again, we can't have an active discussion about this now, but I'd ask you to just hold on to this and maybe we can talk about it for a few minutes when we get to the question and answer period. But hopefully this was a valuable exercise for you to really just think about, as people have mentioned, really your time and your values and your priorities and where they are and where you want them to be. I think this is also something you can do to check in from time to time. Maybe keep the pie either in a file on your computer or in a piece of paper tucked away somewhere if you did it on paper, to really look at this from time to time to keep yourself in check. whether you're a caregiver or not, it's just, I think, a valuable exercise to really say, where am I spending most of my time and energy, and where would I like to? And we can't always make our pie perfect. There is no perfect world, but I often find myself saying, well, you can't be 100% at everything, right? So if I'm being a really good family member that day, then maybe I'm not, you know, the best employee. And of course, we all have to do a great job in all of our roles, but you can only give 100% of yourself. So if there is something that's occupying a lot of your time and energy, hopefully not forever, but for whatever that period of time is, something else may give a little bit, or hopefully not suffer, but things have to balance out. So I think it's just helpful to be mindful of this and to really think about, where are you putting your energy, and where do you want this to shift? Hopefully in your pie. Your pie should be whatever you want it to be, but hopefully there is a piece of taking care of yourself in there as well. And maybe that piece needs to be bigger or smaller at different times. So just something to keep in mind. Hopefully you find this valuable check-in for yourself. So next slide, please, Kat. So what are the components of caregiving, right? And I think that when we think about care for the caregiver, we right away tend to think, oh, caregiving's hard and it's stressful, and it very well may be and can be, but there's also benefits to caregiving, right? As we mentioned, some people go into this as a profession. I'm a nurse practitioner, right? Nurses are known for being caring. I mean, hopefully all providers are, but that's what sort of the field is known as. So I chose to be a caregiver by profession. There's a lot of gratification in that role, right? I wouldn't do it if I didn't love it. So there are a lot of benefits, and even for family members, there is great joy and satisfaction in being a caregiver. But along with that comes the sacrifices and hardships along the way. And sometimes there are feelings of guilt. For example, if someone feels like, well, I feel bad about this and I shouldn't feel bad about it. And so they may have guilt around feeling bad for this being hard or difficult on certain days, or for not being more patient, or not, you know, being more empathetic. There's also a lot of sacrifices that come with this personally, right? Or the feeling of the pie exercise we just talked about, where you can't be everything to everyone and you want to be. So perhaps if you're a parent, you feel like, well, I spent all of my time today caring for my son, but what about my daughter? Or, you know, so-and-so is getting all of the attention and this other person in my life is not, right? And so there is a lot of difficulty, or really hardship that can come with trying to keep that balance. So there is a lot of burden. And again, many people say they would not give this up for anything and would joyfully and gladfully do this. But even when you're doing something you love, there are times when it feels hard or tiresome, or just days when you lose your patience and feel like you've had it and wish you could quit this job that you can't quit, right? Especially if you're a family member who is a caregiver, you don't get a break every time you want one, and it can be stressful. But how do you weigh that out? How do you weigh the benefits and the burdens, or the times that are stressful? And I think there is no perfect solution, and it's not one size that fits all. But I think for each person, it's really trying to weigh out what those things are. Okay, this might be really stressful. Perhaps there's a hospitalization of the person you're caring for, and that's a really stressful time. And then there are other times when things are going really well and everybody's at home doing great, right? And so what are the things that you need to keep yourself fueled to get through those hard times, so that you keep yourself recharged and sort of ready to combat those difficult times when they come? So next slide, please. So let's talk a little bit now about the impact of caregiving. Next slide. So this is just a little overview here of what the different components are of the impact of caregiving. So there's psychological, emotional, and physical components, as well as social, familial, and financial. And we're going to go through each of these a little bit. And again, this is something where I wish there were a live discussion, but I'd love to hear more about this in the Q&A to really for you to think about, what is the area for you as a caregiver, or someone you know who is a caregiver, where the impact is the most profound. And this is going to be different for everybody, and probably different from time to time for yourself as well. Maybe there's times when you feel like I'm emotionally, I'm in a really great place, but physically I'm feeling really tired. Or, everything's going great at home in our family, but I'm still working full time and I'm feeling some stress at work, right? And again, it's never a perfect balance of everything, but where are you feeling the impact most, and where do you need to give some energy? And there's some scales out there. Again, if you're doing this, in person together, but there's some scales where you can just do a little checklist to look at different areas of impact of self-care. And I often use these with nurses when we get asked to be a part of new nurse training, and just taking account of the different areas in our lives. So the physical, the psychological, the spiritual, which sometimes falls under emotional, but all of the different components of where you may need to give attention. And I think sometimes we, without recognizing it, some of the areas may be completely ignored and you didn't think of that. So let's go through each of these a little bit and see what resonates for you. So next slide, please, Kat. Thank you. So psychological is the first one. I think the things that often come to mind right away when we think about the psychological side of care for the caregiver is mental health, right? And everybody experiences some level of anxiety. I think living in the world is an anxiety-provoking experience, especially now, right? In the times that we're living in with the pandemic, there's a lot of stress and everybody is facing a great deal of anxiety. And with that can sometimes come depression. I think even without the pandemic, there are just living with a chronic illness, coping with the day-to-day pace of life. There's a lot of anxiety, and not everybody will feel anxious and depressed, but you certainly can from time to time. And I think it's keeping that in check, or being mindful of that and paying attention to that. And you may look at this picture and think, I wish I had time to sit on my couch, right? But perhaps it doesn't have to be sitting on the couch in the cross-legged position, but perhaps it's just really thinking about what is the state of your mental health. I know for myself, I need to keep that in check when there's days when I'm like, I don't love how I feel today, right? And if it's every day, then that's an issue that needs to be addressed. But I think it's also important to recognize that everybody from time to time may feel some feelings of anxiety or depression or stress or sadness or being happy or joyful or whatever it is. And those are going to vary from time to time, right? We're not robots. We don't walk through the world with everything perfect all the time. But I think it's something to really keep in check and to recognize when there is a need for more support in this area. We know from the evidence that's out there in the literature that there is a great need for mental health support and services for caregivers, and very few of them actually get it. And that is partially because there's not enough resources, and in large part because you feel like there's not enough time to do this. But even now, especially with the pandemic, one of the silver lining things is that a lot of this support is now available online. So you don't have to necessarily drive somewhere and make an appointment, but can you find, an hour, even if it's every 2 weeks, to go online and have a session with someone to get some support? And again, not saying everybody needs this, but just to be mindful of this, of when does it feel like too much and when do I need some support in that area? When can I take 5 minutes to just sit and close my eyes and give myself a mental break? So something to be mindful of for sure. Next slide, please. Along with this comes the emotional impact, and I think psychological and emotional are often tied together, but the emotional piece meaning what are your emotions? When are you experiencing them? How do we keep them in check? Are there times when we feel irritable because maybe we're too tired? Or we've all had those days for sure when you wish you could go back in time and replay a certain scenario and say, I wish I didn't lose my patience, or I wish I didn't react in the way I did, or I wish I wasn't so quick to react, or I wish that I had taken a deep breath or a step back and not snapped at someone, or said something I regretted, or just been more patient with the task at hand, right? And again, this is part of being a human being, but what is the emotional piece? Do you find yourself crying from time to time, or sometimes it's laughing? I know sometimes when we say it's getting punchy, right? When we're overtired and you may be laughing at everything, or these are all normal experiences, but when do you need to keep this in check and say, wow, my emotional health needs a little support? And maybe that support is reaching out to a friend, or for some people this may be spiritual, in prayer or journaling or meditation or whatever it may be, spending some quiet time, taking a walk in nature, sitting somewhere in a place that feels sacred and special to you. But just really, again, along with the psychological piece, keeping that emotional piece in check and recognizing when you feel like maybe it's that I can't control my emotions as well as I'd like. Maybe I'm just exhausted. We're all more emotional when we're tired, right? And so, you know, again, not always we don't all have the luxury of 8 hours of sleep every night and feeling well rested, but I think we all know when we're hitting our wall and need to recharge a little bit. And so it's being mindful of that. Next slide, please. And along with this is the physical piece, and this is a picture of somebody running or perhaps walking, but I think for physical, it's going to be different for everybody. And I think one of the pieces here, we'll get to well-being exercises in a little bit, but one of the pieces here is really just keeping your physical health in check. So aside from actually doing physical activity, it's just, when was the last time you went for a well checkup yourself to the doctor? You know, maybe had your annual lab work done or an annual exam. I'm sure many, many caregivers can relate to, yeah, I've been neglecting this thing, or my back is really hurting. I know here in clinic when we're together, I always ask parents, right, how are you doing the lifting if they're lifting someone? I'm in a pediatric clinic, and so it's usually parents that are often the caregivers, but what is their back like, right? How are they lifting? Are they using a lift? You know, and many caregivers will report having back pain, and that's not the only thing, but just keeping those things in check. You know, there's been some interesting studies out there too, looking at health over time, and I can say even as a provider, witnessing that in times when not necessarily an SMA, but when someone's been, you know, had a child or someone they loved or a parent or whoever it may be that's been in the hospital for a long time, you can physically see that on the caregiver, right? Like perhaps they've put on a few pounds or they've lost some weight if they're not eating appropriately. They're eating hospital food all the time, or they're getting takeout on the way home, or they're not sleeping in their own bed, or they're, you know, I remember a mom once, this was years ago, saying that her teeth, she felt like she hadn't been to the dentist, and she was noticing that she just had neglected that and felt like my tooth is really hurting and I just haven't had a chance to attend to that, and it's going to be a bigger problem if I don't get to it, right? You hear parents joke about sometimes saying, oh, I have more gray hair, but I think that it really happens, stress, right, in a person's body. And so just physically keeping those things in check. I know it sounds cliche, but if we're not taking good care of ourselves, we can't take good care of other people. And so perhaps, you know, really making that time to say, I need to go for that appointment. I need to go for that checkup. I need to get my medication refilled. You know, my stomach's really been bothering me, or my foot, or whatever it may be, and I need to go get this checked out and not neglect it. And again, easy to say, oh, sure, just fit that in, but where does that fit in on your pie, right? Where is that piece of taking care of yourself? And again, we know that there is a lot of evidence out there that health can decline in caregivers and is often something that is not paid attention to. So I would encourage you to think about this as well as you think about your balance as a caregiver. Next slide, please. The social piece, right? What are the social aspects? I know some of you who are caregivers may be rolling your eyes or laughing when you hear this. It's like, oh yeah, right, we don't have any time to be social. Or right now, being social has a whole different meaning to it, of course, but either in normal circumstances, or even now in the pandemic circumstances, what does being social mean, right? A lot of people have felt very isolated and alone over the past year, but we're now slowly getting back to being a little bit more social, of course, safely distance, wearing our masks, right, doing everything that we need to do. But what does that look like? Even if it's social within your own family, you know, have you been able to go sit outside somewhere even and have a meal out, or grab an ice cream on the way home, or whatever it may be? The weather is getting warmer now, hopefully a little bit, but just thinking about socially, right? Where are you? Is it relationships with other people? You know, now there's lots of outdoor things, going for a walk with a friend, even just picking up the phone and having a conversation with a friend that's uninterrupted, or a loved one who lives far away. I think one of the silver linings of the pandemic has been that chance to reconnect with people that maybe you hadn't in a while. Sometimes that's virtually, but just what is that social, what are the outlets for that? And sometimes we hear families say, well, people don't get it, right? I'm a caregiver full time, and you know, other parents or other spouses or other people don't get what my life is like. But whether that's in another circle of caregivers or in social supports outside of caregiving, we all need that outlet, right? No one can be alone or feeling isolated in this. And isolation is a real feeling with caregiving. It's a very valid feeling. Sometimes you feel like you're all alone. No one else in your life gets it quite like you do. This is what you need to do every day. And yeah, sure, it's great for your friends who can go out and go to a movie and do what they want, but for you, life is different. So maybe the support does come from other caregivers, but just finding those outlets for what it means to be social. Maybe that's a support group. Maybe it's, the neighborhood friends that you take a walk with, or maybe it's your pet that you take for a walk or sit with on your lap, or whatever it may be, but just making sure that there is some social connection, especially now when we're all feeling so isolated. Next slide, please. Familial, right? What are the roles that shift when someone's a caregiver? Oftentimes people find themselves in a role that they never imagined. Maybe you're suddenly the primary caregiver when you weren't before. We see, one parent or spouse being at work and the other one staying home. Maybe that's what was a shift in roles. Siblings often experience a shift in the familial role as well. Maybe they were, the big sister or the little sister, and now they're switching that role because suddenly they're taking on more of a caregiving responsibility for their sibling. But you see this shift in families, right? When someone's caregiving, and there's perhaps you find yourself doing things you never imagined you'd be doing because you don't have any other choice. And again, you may find yourself loving it, but it may be something that you never imagined. Oh my, I never imagined I'd leave my work and be full-time at home taking care of my child, or taking care of my sibling, or taking care of my parent, or whatever it may be. But we do see shifts in family roles, and this can take some time to get used to. We also see this shift a lot with, again, I spoke about earlier, but the siblings, right? Not having enough time to really give attention to all of the siblings. And sometimes it can be very helpful to have an outside person take on that role. So someone specially designated to be the one to make sure that the sibling has what they need to go to their practice, or is their homework done, or someone who's paying special attention to them, or spending time with the person who needs to be cared for, so that the parent or caregiver or whoever it may be may get time with that other sibling as well. So again, we know it's not all pediatric, but no matter what age the person is or whatever your role is, there's always a dynamic in families. And so really just paying attention to the shifts that take place when caregiving is involved. Next slide, please. I think along with this comes the financial piece. As roles shift, there may be a shift in finances. I couldn't find a lot of data right now on children, but we do know that it probably costs at least 6 figures, probably over $100,000 to really care for somebody in a year who is living with a chronic illness. And of course, a lot of that cost is absorbed by insurance and things like that, but it costs a lot. And I think every person on this call would be in agreement that yes, there are certainly some expenses, right? There are interesting studies that have been done even about what does it cost to come for a hospital visit, right? You've got to pay for gas in the car. There may be tolls on the way. Parking is no joke wherever you're getting. Then you need to get lunch when you're here on the way home. And there's all these other expenses that don't even involve the medical care. You have to get a babysitter for other kids at home, or transport, or whatever it may be. But there's a lot of expenses, not even involved in the actual care, but just in everything else that comes with it. And there may be a financial shift, especially if someone has to stop working to be at home. And so it's something to really think about and just recognize that this can be a strain, and there are lots of supports out there for this, but it's sometimes hard to find them, or to just recognize that yes, there may be a real shift in finances when now we have a new diagnosis in our family, and things are going to shift not only in our roles but also in our personal finances as a family as well, especially again if somebody needs to change their professional role. Next slide, please, Kat. And so let's talk a little bit now about the emotional needs in our last few moments here together. Next slide, please, Kat. So what are the needs for support? We just talked about all of these different areas and aspects of caregiving. And I think along with the pie exercise, this part really involves taking stock for yourself of what is the support that you need. And this is going to be different for everybody. I could sit here and say everybody should go for a run, but I myself prefer not to run unless I'm being chased, right? And even then, it's probably not a given that I'm going to run. So what is it that you need emotionally, physically? Where is it that you need the support? This is different for everybody. For some people, journaling works great. For some people, calling a friend and having a conversation works great. Other people say, I need to shut down and go for a walk myself, or I need to read a book or watch mindless TV because that gets my mind someplace else, right? This is going to be different for everyone, but I would encourage you to think about what it is that you need, and know thyself, right? Know what it is for yourself, what you need when you are stressed. And I think as caregivers, we always tend to think about the need being taking care of the person that we're caring for, but it's what's that need. They have emotional needs as well, but what is your need for emotional support? We often hear parents say, again, working in the pediatric setting, although we recognize that everybody's coming from that aspect, but I want to just be able to go to the bathroom on my own with the door shut and have that space, right? What is your need? Do you need to just have 5 minutes in a day entirely to yourself? Do you need to take a break when somebody else comes home, perhaps from work or from doing their errands or whatever it may be? Do you need to get up on a Saturday morning and have that time for yourself? Do you need the time on a Saturday night? Whatever it may be, but recognizing where you need that support. Is it spiritual? Is it talking with somebody in your community? And figuring out where that need is so that we're not looking like this thread here, right, where we're worn down and completely ready to snap. It's finding those supports and bringing them into our lives along the way. Next slide, please. And what are some of the essentials, right? I think the essentials really are recognizing all of the domains that we talked about, the physical needs, the emotional needs, the psychological needs. What is it that you need to feel healthy? And again, it will never be perfectly balanced. There will be times when those things will shift. Maybe it's, physical if something's going on for you and that's where all of your focus needs to go. But what are some of the essentials that you need along with those emotional supports? Is it, the financial piece? Do you need a financial planner to help you with that? Do you need, resources? Do you need community support? Do you need caregiver support? Do you need advocacy through an amazing organization like QSMA, right? Where they can say, there are resources here and we can help you. But what are the essentials and figuring out for you? Take a look at your pie. Where do you need to make the piece of the pie bigger or smaller? Where do you need to reach out to somebody and say, I need help in this area. I need a financial planner. I need somebody to help me figure out how I can talk to my boss about the shift I need to make. I need to figure out a way that I can go into the office one day and have that space to do work, or be at home one day so I can be there when my kids get home from school, or whatever it may be. What are the essentials that you need to keep your cup hopefully full, or at least not entirely dry, right? To keep yourself replenished. Again, we don't live in a perfect world, but figuring out what it is that we need. Next slide, please. And along with that comes wellness activities. And again, these are all sort of tied together, right? The emotional supports, the essentials, and the activities for you that you need. Again, this will be different for everybody. Is it yoga? Is it running? Is it sitting and having a cup of tea or a glass of wine, or a chat with a friend, or reading a book, or watching TV? But everybody needs something. Is it a hot shower where no one's interrupting you? And just taking that time for yourself. And so we'll end here together with about a 3-minute little activity that I'd ask you to participate in if you would like. And simply close your eyes and take a pause for a moment. And this will just be very brief. And I want to really focus on here our breathing for a minute. There's lots of mindfulness activities out there and things that really take into account almost meditation or focusing on letting your mind go. But I want to think about together breathing and having a little bit more focus in that area. Breathing is something we all do all the time, right? Unconsciously. But sometimes when we feel that tension, can you really just take a pause? You don't need any equipment to breathe, hopefully, or, like special things that you need to go out and buy. You don't need to get training in it, but you can just really take a moment anywhere you are, in the grocery store, in the shower, in the middle of that stressful situation, at your desk, when your kids are running around or screaming or somebody's crying or wanting your attention, to just stop and pause and do some breathing. So let's practice this together. You can gently close your eyes if you'd like. Take a pause. Take a deep breath. Place your feet flat on the floor and really feel your feet in contact with the ground underneath you. Most of you are probably inside, maybe some of you are outside. Really feel that connection to sitting and having your feet planted firmly on the ground. Now place your hands on your stomach and take 2 to 3 deep breaths. And with each breath, notice your stomach rising and falling with each in and out, which means that your breath really needs to be deep enough here for you to really feel your abdominals, your stomach expanding. So just do that, a couple of breaths here, really in and out. And at your own pace, just take those few deep breaths. When you're comfortable, gently close your eyes if you're not already. And keep breathing deeply into your stomach. And now count to 5 as you breathe in. So count in 1, 2, 3, 4, 5 on the in-breath, and exhale 1, 2, 3, 4, 5. And we'll try that one last time, this time holding your breath in the middle. So deep breath in, 1, 2, 3, 4, 5. Hold, 2, 3, 4, 5. And exhale, 2, 3, 4, 5. And this is something you can do anytime you need to take a pause and just really breathe in and breathe out. Hopefully you feel a sense of calm immediately in that moment when you do that and can carry on with whatever activity you're involved in. So you can slowly bring your attention back. Notice any sounds around you and notice how you feel after just having taken a few deep breaths. And again, something you can do anytime and anywhere. So thank you so much. We'll end with that and move on to the next segment of our webinar for today. And thank you so much for participating.
Thank you so much, Vanessa. We'll be coming back to you shortly to answer some questions that have come in from our audience. And I just wanted to say thank you for that. I'm so relaxed now. And hi, everyone. This is Sarah from QRSMA's Family Support Department. One reminder, as Vanessa mentioned, you still have time to submit your questions in the question box for the Q&A chat, which will be coming up in about 10 minutes. But first, we'd like to introduce Stephanie Hefner. She is representing Genentech and will be presenting today on a brief introduction to Evrysdi. Hi, Stephanie.
Thank you, Rose and Vanessa. Vanessa, that was great, especially right before presenting as well. So welcome, everyone. Thank you for joining us today. As Sarah said, I'm Stephanie Hefner with Genentech. I'm the Partnership and Access Liaison in the greater New York City area. I've been at Genentech for 5 years. I've been in industry for 16 years, and prior to that, my experience was in the clinical setting of the hospital, mostly in children's hospitals across the U.S. Next slide, please. As I said, I'm the Partnership and Access Liaison, and we call ourselves PALS for short. We're the local main point of support from Genentech who supports people living with SMA and their caregivers. We work with the rest of our Genentech My SMA support team to help you throughout your treatment journey. What can a PAL do? A PAL can provide in-person or virtual support based on your preference. Of course, the in-person is not at this present time, but we do look forward to it in the future. We can answer questions on Evrysdi, including how it is designed to work, how to take it, and what results we're seeing in the clinical trials, as well as important safety information. We can also explain your insurance coverage and any potential financial support options that could be available to you. We can also refer to helpful resources, but it is important to highlight that in this role, we don't provide medical advice, as that should always be a discussion between you and your healthcare provider. Next slide, please. There are a few important pieces of information about Evrysdi that I would like to share. Evrysdi was approved by the FDA as a prescription medication used to treat spinal muscular atrophy in infants, children, and adults aged 2 months and older. Next slide, please. It's important to know that Evrysdi is designed to work by helping to make and maintain SMN protein. Next slide. Safety is a #1 priority for us at Genentech. So let's take a look at some of the important safety information. Before taking Evrysdi, please tell your healthcare provider about all of your medical conditions, including if you have liver problems. Please speak to your healthcare provider if you are pregnant or if you are planning to become pregnant. Before taking Evrysdi, you should speak to your doctor, as Evrysdi may harm your unborn baby. If you are a woman who can become pregnant, please speak to your healthcare provider, as they may want to test you for pregnancy first before starting Evrysdi. And as I said, Evrysdi may harm your unborn baby, so you need to discuss taking Evrysdi to see if this is the right time for you to take Evrysdi. In talking to your healthcare provider, you should also be discussing birth control methods that would be right for you. You should be using birth control while on Evrysdi and for at least 1 month after stopping. If you're an adult male planning to have children, Evrysdi may affect a man's ability to have children. If this is of concern to you, please make sure you talk to your provider first for advice. If you're breastfeeding or plan to breastfeed, please know that it is not known if Evrysdi passes into breast milk and may harm your baby. If you plan to breastfeed, please discuss with your provider about the best way to feed your baby while on treatment with Evrysdi. Next slide. You should also be telling your healthcare provider about all medications that you take, not just prescription medications, but also over-the-counter medications, vitamins, and herbal supplements. Another good thing is to keep a list of these medications and supplements so that you can give that to your provider and pharmacist when you get a new medication. Evrysdi comes in a liquid form. That is the only way that you should receive Evrysdi. It is mixed by a pharmacist, and if it comes in a powder form, you should not use it. You should call the pharmacy to get a replacement. It can only be given by mouth or a feeding tube. In handling Evrysdi, it is important to know that if you do get Evrysdi on your skin, you should wash your skin with soap and water. If you get it in your eyes, you should be rinsing your eyes with water. Next slide, please. Common side effects. For later onset SMA, the side effects are fever, diarrhea, and rash. For infantile onset SMA, it is fever, diarrhea, and rash, but also runny nose, sneezing, sore throat, cough, upper respiratory infection, lung infections, constipation, and vomiting. These are not all of the possible side effects of Evrysdi. For more information on the risk and benefit profile of Evrysdi, please speak to your provider or pharmacist. It's also a good idea that you can report these side effects to the FDA at the number shown, 800-FDA-1088, or you can go online at fda.gov/medwatch. And you can also report your side effects to Genentech at 888-835-2555. Next slide, please. The overall Evrysdi clinical trial program includes over 450 people. This includes both efficacy and safety studies. It includes people that have type 1, 2, and 3 SMA. And the efficacy was studied in people ages 2 months to 25 years of age. Next slide. As of February of this year, we have over 1,000 people with SMA who are being treated with Evrysdi in the United States since its approval in August of 2020. This figure includes people with type 1, 2, and 3 SMA, only those people who are taking Evrysdi after it was approved. The figure does not include the 450 people who participated in clinical trials. Next slide. And I apologize, folks, I did not queue up that slide very well, but those are all folks who are living with SMA and taking Evrysdi. I would like to thank you so much for joining me today. If you're interested in learning more, please feel free to reach out. You can visit evrysdi.com, use the PAL locator tool, and find your local PAL and get in touch with them. But please remember, your healthcare provider should always be your main resource for any questions about your health and medical care. On behalf of myself and Genentech, thank you so much for your time today and your interest in Evrysdi. I hope everybody has a fantastic day. Thanks.
Wonderful. Thank you so much for joining today, Stephanie.
Thanks.
So, thank you. Before we close out today's Summit of Strength webinar, we're going to go over a few questions that have come in from our community regarding Vanessa's presentation on care for the caregiver. So Vanessa, I was going to ask you to pop back on, but I see you are there. So hello, thanks for joining back. So we'll jump right into the Q&A. Our first question that came in is, there's little care for the caregiver during these unprecedented times. Nursing care has dwindled this year, which has caused huge gaps in scheduling, and we're hesitant to make demands on our agency because of concern with quality of care. Do you have any advice that you can provide?
Yeah, that's a really tough one. That's a great question, and I think this is a universal challenge even prior to the pandemic, right? People will be really excited when they actually get a fair amount of coverage, whether that's nursing coverage or just a home health aide or whatever it may be. And then the challenge becomes getting those shifts covered. Even if you get the care hours granted, you then need to find coverage. And then on top of that, you need to find coverage with people who you trust and click with and find it's the right fit. So I think even before the pandemic, that's always been a challenge. In the many years I've been doing this, I think it's something that we've always seen over time. And I'm not sure there's a perfect solution other than more caregivers, professional caregivers being available. I do agree with the part of the question where in the pandemic this is more of a challenge because especially people are hesitant to have as many people coming into their home. Caregivers, a lot of them have left their jobs, professional caregivers, because they don't want to work in homes during this time or don't feel safe. Excuse me. And so I think this is a real challenge. I wish I had magical advice for this. My really only advice would be to stick with it and to keep trying. I think it's really one of those things that's hit or miss. And when you find, I had a family the other day who said like, oh, we had somebody we loved, they were great, then we lost them, but now we found somebody else, but it took like 6 months in between. And so I think it's really just sticking with it and continuing to try and to looking for other places for resources. So obviously, you may have a certain agency that's covered through your insurance and you don't get a lot of choices, but even asking around in, community settings, are there people that may know of people within the community that can help? There is a lot of volunteer stuff that's going on now because of the pandemic as well. And obviously you want a trained caregiver, but there may be people who know of other resources that are out there. And so I would say the best advice I can give is to just really stick at it and not to give up on that. But I wish I had better advice because I know that it is a huge challenge without an easy solution.
Great. Thank you so much, Vanessa, for answering that question. So I think we're going to have time for just one last question here. And Vanessa, during your presentation, you really just touched on so many great aspects of how to, make time for yourself. This one came in, they're having caregiving can be very overwhelming, and it seems like, there's not enough time for them to be able to take care of themselves. How do you recommend they get started their day with finding time for themselves, or how can they work that into their days if they really can't find any extra time for themselves?
Yeah, thank you for bringing that up. I think this is something that comes up a lot because caregivers, of course, by nature, are always putting the person that they're caring for first. And again, thinking back to our pie, there's not always just the time or the energy or the ability to give attention to all these other things. My best advice on this, or my thoughts on this, would be to start with something small and to give attention to that. We did a breathing exercise before that was about 2 minutes in length. So maybe it's, people say, I want to run a marathon. You don't start with going out and running 26 miles the first day, right? You may start with taking a walk around the block. And so I think it's small steps and finding ways for that to fit into the lifestyle that works for you. I've heard many people say they sit in the car and, turn off the ignition and sit there for a minute or two and be mindful before they go into their house or move on to the next thing, before they go into their office. So I think it's just finding little ways. It doesn't have to be a grand gesture that's, again, like I'm going to run the marathon, or I'm guilty of this too. I'm going to go to the gym, but if I can't go every single day, then I'm not doing a good job. It's like, well, if you go one day, you're doing better than zero, right? And so I think it's being gentle with ourselves, being kind to ourselves, and recognizing that some effort is better than zero effort, and fitting it in where you can. If it's 2 minutes to breathe, to literally pause and breathe. If it's, 5 minutes to read 2 pages, or watching, a quick video or that makes you laugh, or listening to a podcast while you're in the car, or just doing something that you can do that fits into your lifestyle, because you don't always have the luxury of being able to really carve out that time. And if you do, great, but look again at your pie and see where you need to or would like to give more time and energy, and if not, see where you can fit those things into your already busy lifestyle, and just take those moments to take pause and nourish yourself in the way that you need to most.
Thank you so much, Vanessa, for your time today and your incredibly valuable presentation. We greatly appreciate that. And a big thank you to Rose and Stephanie as well for your wonderful presentations today. We also appreciate everyone who joined in on today's webinar. As usual, you'll be receiving a follow-up email that will have a survey link, and we would love any feedback that you have to share. Also, be sure to visit our website to sign up for our final Spring Summit of Strength webinar, which will be on service dogs. And then once again, we're incredibly thankful for the support from our sponsors for making the Summit of Strength webinar series possible. And if there's anything that we can do for you, or if you have any additional questions, please feel free to email us at familysupport@curesma.org. Have a great day, everybody.